How can the private sector help during the COVID-19 pandemic? Is it time to rethink the role of public-private partnerships? The pandemic is now shifting from Europe and North America to South America, Africa, and other parts of Asia. What is increasingly clear is there are many implications and opportunities for health systems and policy reforms, including improving the economics of healthcare delivery and redesigning health systems financing. There are increasingly more examples of PPPs against COVID-19 around the world. For example, in London, as cases started to rise in March, the UK National Health Service NHS struck a deal to partner with some 28 private hospitals across London to increase capacity for both COVID and non-COVID patient care. PPP services include vital surgical procedures to help lower the burden on public hospitals. Yes, the UK may have missed a window of opportunity to contain cases earlier, but had there not been this PPP increase in hospital capacity, it could well have been even worse overall. Here in Hong Kong, despite much fewer cases, there were also similar PPPs, with public sector hospital authority HA patients being referred to private hospitals for treatment, as HA's capacity was stretched to the limit. The HA has noted that the pandemic forced it to accelerate collaboration with the private sector, transferring more patients to private hospitals for treatment at public sector prices. And even after COVID-19, this partnership will not be reduced, with possibly more PPPs to cover some cancer surgeries in the future. However, some sectors of society have voiced their frustrations that as patients were left waiting for treatment, non-urgent cases were postponed as overburdened public hospitals focused more on COVID-19 patients, with only a small number of public patients actually referred to private hospitals for treatment. Some have therefore called for more PPPs to take on more non-COVID patient care. So from this very brief overview, we can see that not only effective frontline clinical efforts are important, but the financing and the economics of both COVID and non-COVID healthcare services are equally important. Health financing reforms ensure sufficient and appropriate resources are available, and health economic evaluations ensure the fair and efficient allocation and use of these limited resources. So ultimately, in our concerted global fight against COVID-19, we all need strong, unified global health systems and policies to control and contain the current pandemic towards the new normal, and better still, to prevent future waves of outbreaks turning into such pandemics again. So if you'd like to know more about the work of our health policy research team at the OHKF, please subscribe to our social networks, where you can watch all previous and upcoming videos on both COVID-19 and other healthcare topics. And thanks for watching.